Hi, everyone. Welcome back to Modern Sex Therapy Institute's Sexuality Speaker Series. Today, we have the lovely, talented, brilliant Dr. Laurie Mintz. She's worked with us for so many years. I'm eager for you all to hear more about her. Laurie is a licensed psychologist and a certified sex therapist, and I'm going to let her take it from here. Laurie, the first question I love to ask is, how did sex change your life?
Oh, that is a great question. And by that, do you mean the study of sex, the act of sex, the teaching of sex, the writing of about sex, all of it?
You have all of those. I feel like for most of us in this field, there's the personal and there's the professional. So wherever you feel like going with it.
Okay, perfect. Well, I honestly wouldn't say personally. I think it's always been integral part of my life, and I was raised in an unusually sex positive household, like especially for someone. I'm 63. And so my mom was like way ahead of her time in terms of comfort and sex positivity. And I have some actually funny stories I could even tell, but let's leave it at that. But in terms of my career, early in my career, I didn't work in the sex space. I really did a lot of eating disorder work with clients, and that was my specialty. And then, I was always comfortable with sex and always asked clients about sex but really had no formal training. But what I started realizing is when I asked, the answer was always yes, there is something I do want to talk about now that you've asked. So I started getting training on it. I started writing. And what I found is I just literally fell in love with the topic from a professional standpoint
Mhm.
because it has the potential to really empower people, change their lives, not just in the bedroom. I really find that someone, once they get empowered in the bedroom, their life outside the bedroom gets better too. And I never get bored reading about it, writing about it, learning about it. There's always new information. And I feel like it's, also the people I've met, like those of you at Modern Sex Therapy Institute. I mean, it's such a small field. I feel like 99.9% of us in it are really about cheerleading each other, supporting each other, helping each other. So it's just been a beautiful, beautiful fit for me professionally.
I would say, given the breadth of your career and all the wonderful things you've done, which we're going to get to, but for our listeners, do you, Laurie, practice from a particular theory or methodology?
In terms of my clinical work,
Yeah.
I would say I practice from an integrative approach. By that, I mean, I use whatever techniques work, whether it's, Gestalt or cognitive behavioral or psychoeducation or internal family systems. But at the foundation of my practice, the sort of theory is both relational and feminist. So I really practice from I no one can ever convince me that the relationship isn't the core of the work that we do,
Mhm.
and that a lot of a lot of distress, and I think it's particularly due of women's sexual distress, is due to our culture and the horrible messages that we get and the false messages we get. So I really think, so again, I do whatever works in the room, but my basis is always understanding the root of many problems is cultural and that the relationship is core.
Got it. Got it. Great. Um, is there a particular challenge that you're seeing right now in your practice or something that you're really butting up against lately?
Yeah, actually, two things. And I wouldn't say so much in my practice, but in my social media presence, because I mean, my career focuses both on my clients and then my teaching and my writing. And I have a very active social media, especially Instagram, where what I feel like what I'm doing is providing bite-sized education
Mhm.
for people. And the two things that I pop up against our language around gender identity. We don't have the right language right now. We know not everybody identifies as cisgender. And so when I use the terms women and men, I of course get slack from people who identify as trans or non-gender conforming. But then when I use the words people with vulvas, I get pushback from cisgender women saying, don't define me as a body part. So I feel we don't have the right language yet. So that's one thing. And the other thing is porn. Anytime I try to make a post that includes any education on porn, I get so much pushback like, this is the source of all problems. It's unethical. It's horrible. It's harmful, which we know is not what science says.
Right.
I mean, science tells us that it can be helpful or it can be harmful, and it's a much more nuanced conversation. But people are quite polarized on that.
They are. And that would be a whole nother, we'll do that down the road for sure. Laurie, will you tell us your Instagram right now, just so, because you mentioned it, I want people to follow you. So where can they find you on Instagram? Yeah.
My handle on Instagram is the same as my website, Facebook, everything. It's at Dr. Laurie Mintz. So DrLaurieMintz.
Perfect. Okay. The flip side of that question, something you're really excited about these days.
I feel like the orgasm gap might be starting to close. I'm not sure, but I've done a lot of writing and research in that area. And I teach a psychology of human sexuality class with hundreds of students, and I use anonymous polling technology to get some data and information and to teach them. And I have seen a slight decrease in the orgasm gap over the years, which I think correlates with the increase I've seen in women's knowledge of their clitoris.
Of course. Oh my gosh, you just made my day. That is the best news. And I'm probably going to have to share that a few times. Laurie, while we're on the clitoris, tell us about your wonderful book.
Okay, so I have two books, but I think the one you're referring to is my latest book called Becoming Clitorate, Why Orgasm Equality Matters and How to Get It. And it is a combination of feminist analysis and self-help to close the orgasm gap culturally and to empower women to orgasm individually. It's closing the orgasm gap both at a societal and an individual bedroom level.
And for everyone out there, it is such a good book, such an important read. Get it for your clients, get it for yourself, anyone who needs it. Laurie, favorite sex or relationship tip?
Oh, that's let me think. There's so many. I think I'd have to define it by concern, right? Is it for people who aren't orgasming or low desire? But when I think about what cuts across all concerns, it's communication. Okay. So I think, people, we're so afraid to talk about sex. It's so taboo. And so I think the tip I have is, and this is not my quote, and I'm trying to think who it's from, but I love it. Corey Silverberg. He says, I promise you, it is easier to learn to talk about sex than it is to read minds. And to really help people talk about sex outside of the bedroom, before sex, during sex, after sex. And the research really supports that, right? That couples who communicate have better sexual relationships. So I think that's the tip that cuts across all.
That is perfect. Exclamation point. Laurie, thank you so much for joining us, everyone. Dr. Laurie Mintz. She told you where to find her. And for more information, some more great speakers and Modern Sex Therapy Institute sexuality speakers, tune in next week. Thank you so much. See you soon.